Well, our role in the project's been to develop the tools that support the use of the B3 maturity model, and part of that has been gathering data and looking at how people actually use it, and going ahead and working with the people in the other work packages on how to evolve the maturity model to become more appropriate, and also to help with the evaluation of the maturity model, because everything rotates around the tool. Then we can use the tool to gather information. So although it's primarily supporting the activity in terms of integrated care, then the important thing is that we can use the tool as a bigger tool to help us evolve the maturity model and make it more appropriate and more accurate. Well, I think the critical thing about the tool, and if we think about its most important contributions, are how it allows people to develop processes around about it. So it's saying, if you want to understand how a health system works, then you need to bring together groups of people who don't normally talk to one another. And what the tool does is it gives a way both to structure face-to-face meetings around the use of the tool, but also it allows people who are separated by time and space to talk to one another more indirectly by completing their own individual assessments and then looking at how they combine.
Through the project, you've had a very high level of engagement with people and regions throughout Europe. What do you actually feel makes the tool successful?
I think there's a kind of gradient to using the tool, because you can start using the tool very, very easily. It's in terms of people accessing the tool, you can start to use it in as simple a way as possible. You can just do an individual assessment and use it to reflect on what you think about your health system. But then, stage by stage, you can start to look at how to use it in a wider way. So it gives people a nice ramp, if you like, to move up through the use of the system.
And finally, Stuart, where do you see the future of the tool?
I think the thing is that now the tool is something that gives us a good method for doing assessment. And looking forward into the future, then the thing is, what do you do about that assessment? And what we have is we've already looked at good practices and how you adopt them. But I think one of the critical assets of the European Innovation Partnership in Active and Healthy Aging has been the creation of this large database of good practices. And I think where we can go with the tool is look at how we can give people different options for doing implementation of the good practices, and how to understand how their good practices can fit into new health systems. And I think that's where we want to see the process going.